Hello, my name is Mackenzie Rosner, and I'm a student nurse at the University of South Alabama, and today I'll be performing the insertion of the urinary catheter. So here is my badge, and she's going to scan the room. So upon entering the room, I'll perform hand hygiene, and I'm going to verify the order and hospital policy. I'm going to identify my patient using two identifiers. I see this is Mr. Jaguar Jones, born on 8/25/1963, 8/25/1963, and I'll assess for any allergies. See, he's allergic to penicillin. So now I'm going to explain the procedure to the patient, and now I'll evaluate the justification for inserting a catheter into this patient, and it would be 3 examples would be required immobilization for surgery, trauma, or other therapies, strict urinary output monitoring as indicated by plan of care, and to assist in healing of open sacral or perineal wounds in incontinent patients. So I'm going to provide privacy for my patient. I'm going to gather up all my equipment. I'm going to put on my goggles and make sure that my trash can is positioned near me, and I'll perform hand hygiene. I'm going to raise the bed to a working height and lower the side rail, and I'll put my patient in dorsal recumbent position with her legs slightly lifted. And now I'm going to put on my clean gloves and prepare for perineal care with soap and water. So for a male, I would normally place a towel underneath the penis, and if the patient was not circumcised, I would retract the skin, and I would clean the urethra meatus in circular motions from inward to outward. And then I would rinse and dry, and then I would begin to clean the scrotum and the skin folds. And then I would rinse and dry. And I would make sure that my patient was in supine position for a male. For a female, I would make sure that they were in dorsal recumbent position, and I would expose the labia and clean the skin folds on either side from the perineum to the rectum, and then I would rinse and dry. Then I would expose the urethral meatus and the vaginal orifice, and I would clean using separate pieces of gauze with one stroke down. Then I would rinse and dry that part, and then I would remove my clean gloves, skin to skin, glove to glove contact. And now I'm ready to open my catheter kit. And set this to the side. So I'm going to open it away from me first. And now I'm ready to don sterile gloves. So now that I have my sterile gloves on, I am ready to lay the drape over the patient. So I'm going to turn this, and I'm going to remove the drape. So this is sterile, and I'm going to turn it in towards me and put the shiny side down. So I would make sure to put this underneath the patient's legs and make sure there were no gaps or anything. So now I'm ready to place the tray and prepare my cleanser and my lubricant. So I'm going to remove the betadine swabs and dispose. I'm going to prepare the lubricant. And then I'm going to connect my syringe to the balloon port. The cap. Now I'm going to remove the plastic wrapping from the catheter. And I will dispose of that with my hands above my waist. So now I'm going to lubricate the catheter. I would lubricate 1 to 2 inches for a female and 5 to 7 inches for a male. So now I'm ready to clean the patient's genitalia. For a male, I would clean the urethral meatus with the 3 swabs in circular motions from inward to outward. And since my patient is a female, I will retract the labia and clean the far side and dispose, and clean the side closest to me and dispose, and then clean the center of the urethra and dispose. So now I'm going to explain to the patient that I'm about to insert the catheter and encourage them to bear down as if they were voiding and breathe slowly and deeply. And if it was a male, I would make sure the penis was perpendicular to the body. And so now I'm going to insert the catheter until I see urine return. Once I see urine return, I'll advance 1 to 2 inches for a female and insert until the bifurcation for a male. So now I will hold in place and I will apply the water to my balloon, applying pressure. So now I'm going to unscrew this, put it to the side, and now I will gently tug the catheter to make sure it is in place and then advance it so it's not blocking anything. And so now I am ready to place the sat lock. So I would open it and lock the catheter in like this. And then I would want to stick this on the inner side of the patient's thigh. So first I would cleanse with an alcohol swab, and then I would be ready to stick it to the patient's thigh. I want to keep the arrow pointing towards the patient. And then to remove, I would just unhook it. But I'm going to hook it back while I hang this drain bag. So I'm going to hang the drain bag below the level of the bladder and on the bed frame, not the bed frame. So now I am ready to obtain a specimen collection. If the catheter was just inserted, then I would use this container to collect my specimen from the drainage bag. So using aseptic technique, or sterile technique, I will place the cap facing upwards, and I'll have a towel and graduated cylinder to catch any excess or splashing. So I will remove the port, and I'm going to make sure it does not touch my specimen container, and I will open it until I have enough urine for test for a specimen collection, and then I will close the port and replace it back. Now I will place the top on the collection, and I will label the container. For my next specimen collection example, I will use the port on the catheter tube, and so I will use this. I'll remove the top, and first I'll use hospital policy to clamp the tubing and to cleanse the port. So I'm going to use a alcohol swab to cleanse the port, and then I will let it dry, and I'm not going to let it touch anything now that I have cleansed it. So I'm going to use a Lurelock syringe to obtain my specimen collection. And once I obtain that, I will squirt it into this cylinder without touching the edges of the container. And then I will dispose. So now I'm going to unclamp this, and I will place the top on this and label it on the container. So I'm going to put this to the side. So now I am ready to dispose of my stuff, but I would, I forgot to say this, I would use that type of specimen collection from this port when the catheter was inserted a couple hours or days before. So now I'm going to clean my area, dispose of. I'm just going to push it to the side, and I'm going to remove my gloves from skin to skin and glove to glove. So now I'll lower the bed and raise the side rails, and I'll make sure that the comfort measures are within close reach to the patient, and that the call light is within close reach to the patient. So now I will perform hand hygiene and document my findings. I will document the catheter size, amount, and color, and consistency of the urine. I will also document the patient's reaction and the specimen collection. I will also plan to perform care to the catheter daily, and I will also plan to remove the catheter as soon as it is medically directed. So now I am ready to remove the catheter. So before doing so, I would want to do this in aseptic technique. So I will make sure to have my goggles on, and I'm going to put on some new clean gloves. So to start out, I would drain the urine from the drainage bag into a graduated cylinder normally, and then I would measure it in that graduated cylinder. So now I'm going to remove the stat lock of the catheter. And then I'm going to get my syringe, and I'm going to loosen the syringe, pushing it up and down. And then I'm going to pull back to 0.5 milliliters, and I'm going to connect it to the balloon and I'm going to let gravity do its thing and empty the fluid from the balloon. It's almost done. Okay, so then I will move that to the side, and now I am ready to remove the catheter, and then I would remove it and discard it. So more like this item here. And now I will remove my clean gloves. Perform hand hygiene, and then I would document the amount, odor, color, and consistency of the urine. I would also note that the tip of the catheter was intact. I would note the amount of water that was removed from the balloon, and I would document the patient's tolerance of the procedure, and I would explain the signs and symptoms of a UTI to the patient, which would be frequency, urgency, and dysuria. Then I would plan to come back and assess to see if the patient has voided in 4 to 6 hours, and if they have not, then I would palpate the bladder and obtain a scan of the bladder. Thank you.